All right, for release of the upper back, we're gonna grab our foam roller and lay on back. So probably what you see a lot of is something like this, which is fine, but for the parameters of this program, this is gonna be more so assessing and warming the area up. And what you also see is hand placement. So either people's hands are on their body, they're off to the side, but I'm using a lot of muscle to keep my head in alignment with my spine. So what I'm gonna do is interlace my hands behind my head and bring my elbows forward, all right? So it's gonna help open up the upper back. And while we're warming up the area, we're also assessing and looking for the most tender spot. The most tender spot is more than likely gonna be a trigger point. And once we find that spot, you can plant your hips, relax the legs, keeping those elbows pointed forward. And with each exhale, relax the body into that foam roller. We're not pressing into it. We're just exhaling and allowing the tissue to melt around the foam roller. Keeping the shoulders relaxed, keeping the face and head and neck relaxed. Breathing and exhaling for whatever time is written in the program. Or that's going to be more so trigger point therapy. Another approach for the upper back for more myofascial release is starting at the top of the shoulders and driving your heels into the ground. And we're not pressing into it, but we're more so just allowing the body to come up as the foam roller comes down for a very slow and articulated pass over the foam roller. I would say this is a little more advanced and tricky to execute without tensing up, but something you want to keep in mind the whole time is keeping your shoulders, your head, your neck, and your upper back relaxed as you pass. So once I'm about just below my shoulder blades, I want to stop and then come on back up. Slowly come on up. And if you need to readjust your feet or your hips as you come back up, that's fine. You can pass 1, 2, 5 times, however many times you need. If it's written in the program to approach the upper body for 30 seconds, 45 seconds, I wouldn't go any farther past that. But just being sure you're not pressing your body into the foam roller and not tensing up against it either. Just slowly allowing your body to relax into it as you pass slowly up and down. Something I would like to mention is that once we're below the shoulder blades, we start getting close to getting into the lumbar spine. I do see people hitting the low back with the foam roller. Within this program, we don't advise doing that. We have our own techniques, so we're not dumping into the low back at such an extreme level. But once you're just below the shoulder blades, you can hang out here. And if that's your tender spot, which it is for a lot of people, you can stay here and with each exhale, allow the back to come on back. We're not trying to force ourselves back into this arched position. We're just here, and with each exhale, you find that there's a micro movement backwards. That's fine. What we're not trying to do is get into our low back and then get our head and neck and hands onto the floor. That's not what we're trying to do, all right? So for a deeper release of the upper back, some more advanced tools that we recommend using is the Universal Massage Tool by Trigger Point. So same rules apply. With the foam roller, you can either do myofascial release, slow passes, or trigger point therapy. This tool is phenomenal and it's specifically designed for the upper back, but it can be used throughout the entire body. It's very universal and dynamic, if you will. Another tool we recommend, this is great for the upper back and the lower back. It's called the So Spine. It's by a company called So Right, more famously known for their product, the So Right, to hit the psoas. But this clearly is more of a trigger point tool, not necessarily a myofascial release tool. And I'm actually gonna demonstrate real quick on how to approach the upper back with this tool. So the way I do it is I align it roughly where I think it's supposed to be. I come back on my forearms, and it's not down on my low back, which is one way to approach your body with this tool, but for the upper back, about there, and then you slowly just lay yourself on. And once you're on, you can either stay here and breathe and exhale into it. And this isn't necessarily forcing my body into the tool, but to get a different angle and some deeper pressure, you can lift your hips, drive your knees forward, and I'm not pressing myself into it. I'm just changing the angle of the lower half of my body, which is going to put some added weight into the upper body, into the tool. So again, this is advanced. This is not where I recommend you start, but this is a great tool for trigger point therapy of the upper and lower back. All right. Beyond that, very advanced and targeted work is going to be getting the MB1 or the MB1 deep tissue tool by trigger point. And this isn't necessarily something you do on the ground. You're going to want to place it specifically on a targeted area on your upper back while leaning into a wall. And again, if you're doing that, we're not forcing ourselves into it. We're just positioning ourselves against the wall and breathing into it, allowing the tissue to release. And we're not holding that position for more than 60 seconds at a time. I recommend starting with the MB1 if you're going to do that approach. And again, this is advanced beyond these tools. This is like top tier, not where you want to start, but where you want to progress to. I recommend starting with the MB1. And if you feel called to move on to the deep tissue MB1, this red one, you can do so. I would say this is about a half step below a lacrosse ball. We're trying to avoid lacrosse balls altogether, but this is a great tool for deep tissue trigger point therapy.